Dr. Gary Bellman, follow up on President Biden's prostate cancer diagnosis. I've said all along, I don't believe he knew about this, and I believe it was a recent diagnosis. And I think this is a teaching moment that men should get screened for prostate cancer. And I bet that he was not screened for prostate cancer because of his age. And people responded, hundreds of people responded, well, he had the very best doctors. I'm sure he got screened. Well, that's the whole point of this. The very best doctors, primary care doctors, believe that screening men for prostate cancer above a certain age does more harm than good. And there are many excellent doctors who are convinced that screening men for cancers after a certain age just kind of digs up a hornet's nest and causes more harm and more angst than necessary. Reporting came out today that he was last screened for prostate cancer in 2014, over a decade ago. People on my post said, oh, he must have had a high-grade neuroendocrine prostate cancer. That's exceedingly rare. In my 30 years, I've never seen a high-grade neuroendocrine prostate cancer that doesn't produce PSA. His prostate cancer was Gleason score 9 prostate cancer. That's an adenocarcinoma, and I suspect his PSA would have been elevated, and I suspect if he was screened, it would have been found years ago and probably before it was metastatic. I wish President Biden well, and there are newer therapies for advanced prostate cancer. The take-home message is PSA is not perfect, but it's the best test we have. Men should get an annual PSA above the age of 45 or 50, and changes in PSA are useful and sometimes indicate the need for an MRI. So that's the take-home message. Screening helps. The very best doctors are convinced that screening for certain things are not necessary and in someone's best interest, and sometimes don't even tell the person that they're not screening for certain things, and they assume they're doing the best. In this case, I don't think they did their best.